also been a member of the World Health Organization Stop TB Partnership for years. It's my great pleasure to introduce Dr. Reichman this morning. Thank you.
Thank you very much, Nisha, for that generous introduction, which I wrote. And it's really a pleasure to be back here. Some of you don't know, most of you don't know, that when I was a medical student, I lived at 33 Washington Square West, which is right over there. They had a job for medical students at NYU. They gave 3 of us $30 a week each, plus an apartment overlooking Washington Square to take care of NYU students. It was one of the great things ever. Second to zero TB days. 132 years ago this Monday, an announcement was made in Germany and around the world. The world changed on that evening of March 24th, 1882, when a thin, nearsighted 38-year-old German physician, Robert Koch, read the paper to the Physiological Society in Berlin. Reading his brilliant paper through his thick glasses, Koch told his audience that tuberculosis was an infectious disease caused by a bacterium. He spelled out scientific evidence to prove this in meticulous detail. It was astonishing news. At last, the cause of the disease that had terrified humanity, possibly more than any other disease for millennia, had been identified. When Koch finished his presentations, the audience sat in stunned silence. Koch's news was just as shattering to his listeners as the news that the earth was round, not flat, had been to their ancestors. This was a profound change, a revolution in scientific thinking. The doctors and scientists in that Berlin hall had just heard that the major killer disease of their time was not inherited, it was not mysterious, it was an infectious disease that was spread through the air by bacteria. And that meant that one day it might be prevented and cured. On that March evening in Berlin, Koch noted that 1/7 of all human beings die of tuberculosis. And if one considers only the productive middle-aged groups, tuberculosis carries away 1/3 and often more of these. At the time, there was real hope that mankind's biggest killer, with its cause identified, would soon succumb to appropriate prevention and treatment measures. One would think that in 132 years and counting, this might occur. But here we are, 132 years later. TB is still the world's biggest killer due to a single organism. It's been named a global health emergency by the World Health Organization. Drug-resistant forms are proliferating, and this year, preventable and curable tuberculosis will kill more people globally than when the organism was described by Koch in 1882. Here, over the past 20 years, New Yorkers have been able to withstand a public health disaster caused by the perfect storm of AIDS, homelessness, poverty, at the same time as the essential public health infrastructure and its fiscal support were decimated by short-sighted budget cuts and lack of political will. 20 years ago, in 1993, 2 New York City heroes, former health commissioners Margaret Hamburg and Tom Frieden, Tom also directed the TB efforts, responded memorably to that disaster. turn the epidemic around. But they did, and New York's success remains a proud example for the world of what can be done through rational and effective political will. Now, 20 years later, TB rates are at historic lows in both our country and New York City. The infrastructure rebuilt by Friedman and Hamburg, although now smaller, is efficiently providing diagnostic, prevention, and treatment services, thus protecting all New Yorkers and their friends and families. TB and MDR-TB are airborne diseases fueled by inattention and complacency, which often occurs after major successes. But TB is a transmissible disease that can recur any time. The new mayor and health commissioner, I hope, will recognize the importance of staying ahead of the curve so that the disaster of 1993 is not repeated. TB is still a global nightmare. This preventable and curable disease paradoxically kills 1.3 million people globally annually, according to WHO. In New York City, even though a large port of entry continues to lead the way as an example of effective and efficient TB control. Today, on World TB Day, we recognize the singular events of 1882, but we should also recognize that sustained progress against the disease is critical. We still have some areas that urgently need attention. There remain insufficient financial and human resources. There remains an inadequate healthcare infrastructure. There remains weak laboratory capacity and lack of new rapid diagnostic tests. There remains a lack of new drugs that will cure TB in a shorter time. There remains a tragic shortage of drugs and diagnostics that make a difficult task of finding diagnosis and treating our patients doubly difficult. There remains a lack of effective vaccine that would prevent TB in the first place. There remains poor use of infection control in healthcare settings, and there remain the HIV and MDR-XDR threats. And there remains minimal social mobilization for TB control and minimal population awareness, leading to stigma. On this World TB Day 2014, we can celebrate that so far, New York City has met and exceeded its challenges, for which congratulations. And I sincerely hope to be able to witness the good works and correct priorities continuing. But on this World TB Day 2014, we can also recognize that TB remains a major global threat with MDR-TB, drug shortages, and the ever-present potential for waning political will. And zero TB still